Alright, hi everybody. So this is Tori and Sarah. Today we're going to be talking about the shoulder. So we're going to start with range of motion of shoulder flexion and then range of motion of shoulder abduction. So for shoulder flexion, you want your client to be lying in the supine position with their knees bent. And then you're going to take your goniometer and we're going to have Sarah flex her arm as far as she can go. And so our fulcrum is going to go over the axis of movement around the axilla, and then the stationary arm is going to be in line with the lateral midline of the thorax, and then the moving arm is in line with the lateral epicondyle of the humerus. And so Sarah is at about 170, which is great because the normal range of motion is 150 to 180. So now for range of motion of shoulder abduction, she's going to put her legs down straight. And then what she's going to do is she's going to start out fully in external rotation and then abduct her arm as far as she can. And again, the fulcrum is over the axis of movement, right on the axilla, and then your stationary arm is lined up in the same way, and the movable arm is lined up with the medial epicondyle of the humerus. And so Sarah is at about 175, which is great because the normal is around 180.
Hi everyone. Today we're going to be doing range of motion of shoulder extension. So to start off, the patient must be prone with their palms facing their body. And I'm going to take the goniometer and I'm going to align the fulcrum to the greater tubercle of the humerus, so right about there. And the stationary arm is going to be aligned with the midline of the thorax, while the moving arm is going to be aligned with the lateral epicondyle of the humerus. So the patient's going to extend her arm. There we go. All right. And Tori has about 50 degrees of shoulder extension, which is great because the normal range is between 50 and 60 degrees.
All right, so now we're going to do range of motion of shoulder external rotation and shoulder internal rotation. So our patient is going to be in a supine position, and they're going to start with their arm abducted to about 90 degrees, and then the elbow is going to be bent at about 90 degrees. And so we're going to take our fulcrum of the goniometer and line it up with the olecranon process, and then the stationary arm is going to be lined up with perpendicular to the floor, and then the movable arm is lined up with the styloid process of the ulna. And so first we're going to do external rotation. So Sarah's going to move her arm back as far as she can. Great. And Sarah has about 92 degrees of external rotation, and the normal range of motion is about 90. And so for internal rotation, all of our processes where the goniometer lines up are the same. So we're going to go back to that position, and Sarah's going to move into internal rotation, so this way as far as she can without that shoulder popping up. So right about there. Sarah's at about 70 degrees of internal range of motion, and the normal is about 70 to 90.
Hi, and today we're also going to be doing manual muscle testing for shoulder flexion. So to start off, we're going to start by palpating the anterior deltoid, so it'll be right around there. And the patient's going to raise their arm to a 90-degree angle of the shoulder. And we're going to stabilize the shoulder while I apply resistance at the distal humerus, pushing downward. Great. And the patient would score 5, meaning that the patient is able to withstand the resistance and complete range of motion thoroughly. Now we're going to be doing the manual muscle testing for shoulder flexion, gravity eliminated. So the patient must be lying on their side with their arm resting on a low friction surface. And once again, I'm going to palpate their anterior deltoid while the patient completes the motion. The patient would once again score a 5.
So now we're going to be doing the manual muscle test for shoulder extension with gravity resisted. So your patient is going to be in a prone position with their arm completely internally rotated, like Sarah is. And then you're going to test the range of motion while palpating the teres major. So go ahead and extend. All right, and so then while she's in extension, we're going to apply increasing resistance downward as she tries to resist that on the distal humerus. Awesome. So that would score a 5, meaning that she is able to move fully through the range of motion and resist the resistance completely. So now we're going to be doing the manual muscle test for the gravity eliminated version of shoulder extension. So the patient will be lying on their side with their arm on a low friction surface. And so we're once again going to palpate the teres major as the patient moves through the motion. And so that again would score a 5.
And now we're going to be doing manual muscle testing for shoulder abduction, gravity resisted. So to start off, the patient must start off seated with the shoulder extended to a 90-degree angle. And I'm going to palpate the middle deltoid right here while the patient goes through the motion once. Okay. And now I'm going to keep it at a 90-degree angle. Okay. Now we're going to apply resistance to the distal aspect of the humerus. Good job. And the patient would score 5, meaning that the patient is able to withstand the resistance fully, and she is able to also move thoroughly through the range of motion. Now we're going to be doing the manual muscle testing for shoulder abduction, gravity eliminated. And to start off, the patient must be laying in a supine position with enough space to move through the range of motion. So to start off, once again, I'm going to palpate the middle deltoid, and the patient is going to go through the range of motion of shoulder abduction. So the patient would score a 5 once again.
So now we're going to do the manual muscle test of shoulder abduction in the scapular plane. So you're going to start in a seated position, and the patient's going to raise their arm at a 90-degree angle with their thumb up. And so you're going to palpate the supraspinatus as they move through the motion. So then we're going to go ahead and support the shoulder while we apply resistance to the distal humerus, and they're going to push back. So, awesome. So that would score a 5, meaning that the patient can move through the range of motion fully and can resist the resistance fully. There is no gravity eliminated version of this test.
Now we're going to be doing manual muscle testing for internal rotation of the shoulder, gravity resisted. So to start off, the patient must be lying in a prone position with the their head facing the opposite way, and their shoulder must be in a 90-degree angle, just like that. And to start off, we're just going to assess the range of motion, and by doing that, I'm going to stabilize the shoulder and palpate the subscapularis muscle. So right down here, and I'm going to hold this and assess the range of motion. Just relax. Okay, and now we're going to apply resistance while I stabilize the shoulder. So you can resist. Okay, so the patient will score 5, meaning that the patient is able to withstand the resistance fully and also able to move thoroughly through the range of motion. So now we're going to be doing shoulder internal rotation manual muscle testing, gravity eliminated. And to start off, the patient once again is laying in a prone position with their arm hanging off the table, just like that. You can see a little better now. And I'm going to once again stabilize the shoulder and palpate the subscapularis muscle while the patient performs the movement. The patient would once again score 5. And now we're going to be doing manual muscle testing for the shoulder horizontal adduction. And to start off, the patient must be lying in a supine position, and her shoulder must be at a 90-degree angle as well as her elbow, so just like this. And I'm going to start off by stabilizing the shoulder and palpating the pectoralis major, and while the patient moves through the motion. Okay, and now we're going to be applying resistance. So I am going to come over here, and you can see this, and I'm going to stabilize the shoulder, and I'm going to apply resistance to the distal humerus. Okay, and the patient would score a 5, meaning that the patient is able to withstand the resistance as well as move thoroughly through the movement. Now we're going to be doing the manual muscle testing for horizontal shoulder adduction, gravity eliminated. So to start off, the patient must be sitting, and the shoulder must be at a 90-degree angle, and as well as her elbow at a 90-degree angle. And I'm going to come over here, and I'm going to palpate the pectoralis major while the patient goes through the movement. Great. The patient would also score 5.
So now we're going to be doing the manual muscle test of scapular elevation, gravity resisted. So our patient is going to be seated, and they're going to turn their head away from the shoulder that we're testing. We're going to palpate the upper trapezius muscles, and then the patient is going to elevate their scapula, so go ahead and shrug up. And then we're going to apply resistance down in a downward. So push down and resist. Awesome. So she would score a 5, meaning that she is fully able to do the range of motion and resists the applied pressure. So now we're going to do the gravity eliminated version of the scapular elevation manual muscle test. So our patient is going to be lying in the prone position, and we're going to palpate the upper trapezius muscles again, and then our patient is going to move through the movement. And so that would score a 5.
So now we're going to be doing the manual muscle testing for scapular abduction and upward rotation. So to start off, the patient must be facing the other way, sitting in a sitting position, and I am going to stabilize the scapula and palpate the serratus anterior. So while the patient completes the movement. So okay, perfect. And now we're going to apply resistance. So by doing that, I'm going to stabilize the scapula once again, and I'm going to apply resistance to the distal humerus, trying to externally rotate the scapula while doing so. Good job. and the patient would score a 5, meaning that the patient is able to withstand the resistance fully and as well as complete the range of motion thoroughly. And there is also no gravity eliminated test for this type of specific muscle manual testing.
So now we're going to do scapular adduction and downward rotation, a manual muscle test. And so the patient is going to be in the prone position with their head facing away, and the arm is going to come back, and the hand is going to rest over the gluteal region. And so the patient, we're going to palpate the rhomboids as the patient goes through the motion. Great. And then we're going to apply resistance in the direction of abduction and upward rotation on the scapula. So go ahead and resist that as you go. Great. And so that would score a 5, meaning that the patient can fully move through the range of motion and can fully resist the applied resistance. So now we're going to do the gravity eliminated version of the scapular adduction and downward rotation. So the patient is now going to be seated, but the position of their arm and hand is going to be the same. So they're going to bring it back on their back, and then they're going to go ahead and move their arm almost like a chicken would flap their wing. Awesome. So she would score a 5.
So now we're going to be doing the manual muscle testing for scapular adduction and depression. And to start off, the patient must be laying down in a prone position with her head facing the opposite way. And I'm going to extend her arm over here to about 130 degrees. You can rest it right here. And I'm going to palpate the lower trapezius muscles. So right about there. And while the patient completes the motion. Okay. And I'm going to apply resistance on the scapula, and I'm going to push it towards an abduction and elevation while the patient completes the motion. And the patient would score a 5, meaning that the patient is able to withstand the resistance fully and as well as complete the range of motion thoroughly. There is also no gravity eliminated manual muscle testing for this particular motion.
One common shoulder injury is a tear to any of the rotator cuff muscles. Commonly, it can be a tear to the ligament of the supraspinatus muscle, and it can be caused by a lot of overhead reaching or throwing. So with jobs like that or sports that involve that, can cause that, and age can also cause it.